Hi, my name is Ryan. I'm an occupational therapy assistant in the Rehab department. The objectives for today's training are to learn how to safely mobilize patients, how to prevent falls when possible, and how to assist patients if they are falling. We will also learn to understand precautions and different braces that may affect a patient's mobility. For body mechanics when mobilizing a patient, it's important to never bend at your back. You want to squat and use your legs. It's also important to keep a patient close to your body so that you have leverage. You want to ensure that before you stand a patient, you have their feet firmly on the floor with safe footwear.
Hello, my name is Sean. I'm from our rehab department here at Cooper Hospital. Today we're going to talk about a few precautions that some patients may have. Weight-bearing precautions can vary from full weight bearing is tolerated, or partial weight bearing, or non-weight bearing. Some other precautions we have are spinal precautions, which means no bending, no lifting, and no twisting. Craniectomy precautions: when a patient has undergone a craniectomy, they will require a helmet at all times. For hip replacements, there's an anterior and a posterior approach. Anterior precautions are no extension, no external rotation, and no crossing of the legs. Posterior precautions are no flexion past 90 degrees, no internal rotation, and no crossing of the legs. Sternal precautions: a patient that's undergone any sort of sternal surgery, they will not be able to use both arms to push, pull, reach behind, lift overhead, or lift any more than 5 to 10 pounds. Any patient that is on a fall precaution should be wearing a yellow gown, yellow socks, and a yellow wristband.
Hi, my name is Delia. I'm a physical therapist under the Rehab department. Today we're going to talk about two common braces that you'll see your patients wearing. The first one is an aspen collar. Patients should avoid using pillows under the head when they are wearing an aspen collar. Ortho and neuro will determine when the patient needs to wear it and how long they'll need to wear it for. Adjustments of the aspen collar should be made with two people when the patient is supine. The next brace that we're going to talk about is a back brace. For most patients, back braces should be donned when supine. That is noted by ortho and neuro. If a back brace is for comfort only, then the patient is able to determine in what position they can put it on. We are going to review common equipment that you'll see here in the hospital. The first one is a rolling walker. To measure the walker for a patient, the walker is going to align with the patient's wrist. That's how to determine how tall or short to have the walker. The same thing goes for a cane. You're going to measure a cane with the patient's wrist to know the correct height. A commode is going to line up with the back of a patient's knees. That's when you'll know the correct height of the commode. It can be adjusted by the bottom.
Hello, my name is LaToya. I'm a critical care tech on Telemed 7 North Trauma. I'm under the Department of Nursing.
We will show you now how to mobilize a patient to the edge of the bed. First, you want to start by introducing yourself to the patient and explaining what the purpose of your mobility is. The next step is to have the patient bend one of their knees. You will have the patient then reach for you or for the rail with the same arm. Now you will turn the patient, have them help as much as they can towards you. Once the patient is on their side, have them or assist them bringing their knees over to the edge of the bed. The person in the back will help with the shoulders, the person in the front can help with the knees. To get the patient back to bed, it will be a reverse of how you got them to the edge. The person in the back will guide the patient's shoulders, the person in the front will guide the knees, making sure you bring them to their side first and then rolling to their back. Many times, a patient is too far down in the bed and requires a boost. You may need to raise the height of the bed to adjust to the mover's height. You always want it to be at the hips of the shorter person. To mobilize the patient, use an underhand grip on the sheets. Have the patient cross their arms and tuck their chin. Nice wide base of support. And boost on 3. If the patient slides too far forward while edge of the bed, there are two methods to get the patient back to a safe position. The first involves one person blocking the knees in the front and the other person behind the patient, either underneath the arms or grabbing onto the sheet. They will pull on 3 to bring the patient back safely. The next tactic is known as a fireman's lift, and it involves both mobilizers lifting from underneath the patient's arms and legs. For a one-person sit-to-stand transfer, you can use a bear hug technique. This is particularly useful when a patient has weight-bearing restrictions on their upper extremity. For this transfer, the mobilizer will come in from the side and utilize their arms around the patient's waist, rocking forward 3 times and standing. For a 2-person transfer, the mobilizers will stand to the side of the patient. They will use their outside arm to scoop underneath the patient's arm, use the inside arm to scoop behind the patient, and have the patient grab the elbows. To pivot to a chair or commode, the mobilizers will adjust their grip by having the patient grab onto their outside hand and guiding the patient at the hips or underneath the elbows towards the chair or commode. Prior to sitting, have the patient reach back for the chair or commode. We will now demonstrate how to mobilize a patient using our stand and pivot device, the Steady. First, widen the legs and bring the device close to the patient. Have the patient place their feet on the platform and lock the wheels. The patient can now either push from where they are seated or grab onto the device to stand. They may need assistance. The back flaps can then be placed down and have the patient sit. Unlocking the wheels, the patient can now be mobilized to the chair, commode, or other seated surface. Have caution, the weight limit for this device is 400 pounds.